Today we've got some interesting news to report, so I want to take you through it very carefully. So we have 5 new cases. 2 are in hotel quarantine from overseas, so they're fine. But we have 3 locally acquired. Dr. Young will go through in some detail, but I'll just give you a quick snapshot. So we have one person who has tested positive, who's a 12-year-old. And what happened was they had completed their quarantine in Sydney and they flew into Brisbane on QF 544 on the 9th of July. And that 12-year-old has tested positive. The close contact of the 12-year-old, a parent, has tested positive. And then we also have, in addition to that, at the international airport, we also have a fully vaccinated international airport worker who's tested positive. So that's we're treating that as 3 cases in the community, and we are a little bit concerned about that, so I'll take you through what we're going to do about those in a minute, and Dr. Young will go through some further details for you. But that means we've got 50 active cases. We've had 12,350 tests in the past 24 hours. And once again, it's crucial, if you have any symptoms, to get tested. So this young boy presented with symptoms and went and got tested. So if anyone has any symptoms out there, please, that's what's going to keep our community safe, if you go and get tested. And in terms of vaccines, we've had 14,605 in the past 24 hours. Okay, so what does this mean in relation to tomorrow? Remember, we were looking at easing our restrictions from 6 a.m. Now, I'm sorry to say that because of those new cases and the fact that we need to get our contact tracers on top of those cases, we are going to ask those 11 local government areas, and I'll go through those in a minute, for all residents living in those areas to continue wearing masks for another week. Okay, so that is to avoid a lockdown. We just want to make sure we get on top of those cases, and we want to make sure that we keep everybody safe. So another week of wearing masks, but it's the right thing to do. So we've had extensive meetings this morning with Dr. Young, and I'm very comfortable to advise the people in Greater Brisbane about that. So the LGAs are Brisbane City Council, Logan, Moreton Bay, Ipswich, Redland, Sunshine Coast, Gold Coast, Noosa, Somerset, Lockyer Valley and Scenic Rim. Now, for those families living in Townsville, your restrictions will be eased. Remember, they were part of that Greater Brisbane area. We also included Townsville, so Townsville comes off that. So their restrictions will ease from 6 a.m. tomorrow, but we won't be able to ease our restrictions in the Greater Brisbane area, and I know people are going to be disappointed by that. I'm disappointed by that. Dr. Young's disappointed by that. But what we're seeing is that these outbreaks are happening across the country. We've seen what's happened in Victoria overnight with additional cases. We've seen this son and parent come from Sydney out of hotel quarantine and testing positive, the international airport worker. So we've just got to get on top of these things quickly. So I'm asking Queenslanders for their patience and understanding, because we've got to get this right. Now, in relation to what's happened in Victoria, I have another clear message for people in Victoria. So if you're a Queenslander, do not go to Victoria at this time. If you are a Queenslander currently in Victoria, maybe reconsider your travel and think about coming home. Okay, and of course we've said to Queenslanders, reconsider your travel into New South Wales as well. I cannot be clearer. We are seeing these little spot fires happening across the nation, and we need to make sure we get this under control. So thank you everyone for your patience and understanding, and I'll let Dr. Young now go into a bit more detail. We'll be putting up those exposure sites, of course, during the day. The contact tracers have been working extensively already, and I thank them for their hard work. It's a big job to do, and they've done a great job up until this point, so we've got to keep them focused. And like I said, just keep wearing this mask. And of course, if it's your turn to get vaccinated, go and get vaccinated. Thanks.
Thank you, Premier. So 5 new cases in Queensland overnight, 2 of them detected in hotel quarantine. One of them is a person who returned from Kenya and tested positive on their first day in quarantine. The second is someone who returned from India and tested positive on day 5 in hotel quarantine. Then we have 3 locally acquired cases. The first is a young boy, 12-year-old boy, who travelled with his mother to the United States, to Los Angeles, for 3 months and returned into Sydney on the 21st of June. He and his mother then went into hotel quarantine in Sydney, and following that they then arrived into Queensland, into Brisbane, on Qantas Flight 544 on the 9th of July. They live in Newport in Brisbane. So he became unwell that evening after they'd arrived back and went and saw a doctor at the Aspley Medical Centre on the 13th of July, visited the adjoining pharmacy in that centre and then got tested on the 13th of July, and that result came back late yesterday. We then have tested his parents. His mother has tested negative at this stage, but she's now in hospital with her son, and the father has tested positive. He did not travel to the United States, but he did go to the airport to pick up his son and his partner. So he works in a financial services firm at, it's the Roland Financial Advisory Service at Cotton Tree near Maroochydore, and went to work yesterday while infectious, so we'll be contact tracing there. And he hasn't been, at this stage, we don't believe that either the child, their mother, or the father have been to any other exposure venues, but of course we're going through and talking to all 3 at the moment to see where else they might have been. So that's the first 2 cases. And we hopefully will get genome sequencing back later today, so we'll be able to say where the boy acquired the infection. Now, the third locally acquired case is a worker at the Brisbane International Airport, a woman in her 40s who lives in Tarragindi. She was fully vaccinated with 2 doses of Pfizer, completed that vaccine course back in March. She became unwell on the evening of the 13th, so Tuesday the 13th of July, so went and got tested first thing the next morning and has come back positive. So we're deeming her infectious from late on the Sunday when she was at work at the Brisbane International Airport from 6 p.m. through to 11:30 p.m. Then she went to Woolworths Annerley on the Monday, and she used the check-in app and checked in at 10:36 a.m. and was there for an hour. Then she went to work at the Brisbane International Airport. Then Tuesday she worked at the Brisbane International Airport. Then Wednesday she went to Chemist Warehouse at Annerley at 8:39 a.m, again checked in, was there for about 10 minutes or so, and then went and got tested. So I'm very grateful to her. She came forward as soon as she developed symptoms, and she was using her QR code check-in. So we'll now be able to work through, and we've already started texting people who were in those facilities at that time that we've been able to pick up out of the QR check-in code process. So we'll now work through again getting genome sequence results as to how she's acquired the infection. There's multiple ways she might have acquired it. We really have to wait for that whole genome sequence result. So we now in Queensland have 50 active cases, 1,752 to date. Yesterday, thank you to everyone who came forward to get tested. We did 12,350 tests, which is a very good testing rate. We did 14,605 vaccines, and that is becoming increasingly important. Please, anyone who is 60 years of age or older, please immediately, if you haven't had your vaccine, go to your GP. There is plenty of AstraZeneca vaccine available, and get your first dose of vaccine. Anyone who's had one dose of the AstraZeneca, please, at 12 weeks, go and get your second dose. It is really, really important. And it doesn't matter what age you are, please go and get your second dose of AstraZeneca if you've had one dose. It's very important. So 1.83 million doses of vaccine have been delivered in Queensland to date. We today in Queensland have 5,190 people in quarantine, and thank you to every single one of those. 1,682 are in home quarantine, 3,508 in government hotel quarantine. So because we've now got these 3 new community cases, and I suspect, I'll get confirmation later today, but I suspect they're unrelated to all of our other cases. They're new cases, new outbreaks. We will need to maintain those restrictions that we've had in place for the last 2 weeks, and they will continue until 6 a.m. next Friday, so for an additional 7 days. So they're the restrictions in place in southeast Queensland. They will continue unaltered for another 7 days, and for the rest of Queensland there are some restrictions there. Those restrictions will remain, and Townsville, Magnetic Island and Palm Island will return to those restrictions. They won't maintain the restrictions for southeast Queensland, because the risk is definitely down here in southeast Queensland, and we just have to work out what that risk is. I'm very concerned about the Brisbane International Airport worker. They've been working at the airport for 3 days while infectious. Nothing to do with them. They did absolutely the right thing, and they were vaccinated. But we now have to see where they've been working, who they've come into contact with. There is a significant risk there, and any of those people could, of course, have gone home anywhere in southeast Queensland. So we just need to maintain those restrictions for another 7 days. I know they're difficult. I'm sure everyone's sick and tired of wearing masks. They're uncomfortable, but they're extremely important. And if everyone continues doing it, coming forward and getting tested, then hopefully we won't be required to go into a lockdown. That's the thing we all absolutely want to avoid. Then we're watching very, very closely what's happening in both New South Wales and Victoria. And New South Wales, I got their sewerage testing results again this morning. There's been no detections in sewerage outside their lockdown area, so that is very good. So we can maintain our current border position with New South Wales, but I really, really strongly reiterate that people should reconsider any need to go to New South Wales, because they could have an outbreak anywhere throughout the state due to someone going out and spreading the infection. So if you don't need to go to New South Wales at this time, I'd strongly recommend that you delay that travel. Similarly in Victoria, so yesterday morning they announced 1 case, then through the day another 10 cases, and they've got multiple outbreaks due to multiple incursions of the virus from Sydney. So they're working those through very effectively. They're very practiced at this, but there's an increasing risk there. So I also strongly recommend, very strongly recommend, that people reconsider any need to go anywhere down to Victoria at this time. Delay your travel if you can. And if you're already down there, I think you should look at your risks in terms of whether you need to stay there, because if there were to be an uncontained outbreak, then of course we'd be declaring hotspots and asking people to quarantine on return. So people really need to take that into consideration when working through all of their plans. Thank you.
We understand that this will come as disappointing news to people in southeast Queensland, particularly to our hospitality businesses who are looking forward to those eased restrictions tomorrow. But it does appear that this virus has again escaped either Sydney or the hotel quarantine system. This decision is the right decision based on the best possible advice. The fact is, an extra week of masks is better than a lockdown, and that's what we're trying to avoid.
So the message is simple: social distancing, good hand hygiene, making sure you're wearing your masks, and also staying home if you are unwell and getting tested. Remember that we're only able to detect these cases and quickly contact, trace and contain because people are coming forward and getting tested. And we're very pleased that this young boy got tested, and also the international airport worker. So we need people to take any symptoms whatsoever seriously and get tested at any one of our clinics, public and private, across Queensland. Please, if you are unsure of what the restrictions are, then have a look at the Queensland COVID website, where we have the roadmap there explaining what the restrictions are. Everything we have had in place across 11 local government authorities in South East Queensland will remain in place for another week, and Townsville, Palm Island, Magnetic Island will change back in line with the restrictions that apply for the regions. Also, anyone who is in Queensland who has travelled interstate or overseas, particularly New Zealand, we ask that you constantly monitor our website and check the links for the states or territories you've been in. Tasmania also has exposure sites currently. So we're aware of a gentleman who was in Tasmania who travelled to the UK and has tested positive on arrival, and it is believed was positive while in Tasmania. So if you've been to Tasmania, if you've been to Victoria, if you've been to New South Wales, please constantly check the website, at least daily, to check whether you have been to any exposure site and whether you've travelled anywhere around the country. It doesn't hurt to just go on each day and have a look if there is any exposure sites and where you've been. If we all do this, we can keep our community safe. And of course, as Dr. Young said, if you have a booking for a vaccination, please make sure you keep that booking. And if you are 60 plus, contact your local GP that is vaccinating and get your vaccination, whether it's your first or second when it's due, because the more people that are vaccinated, the safer we can make our community.
So to start on a quite positive note, and a note of thanks to Queenslanders in the southeast in particular who've been in the restrictions, we have seen very good compliance overall. The compliance at the State of Origin last night was excellent. We did hand out 39 masks yesterday, but happily there were no fines or any action having to be taken in terms of enforcement at this stage. So thank you to Queensland, thank you to South East Queensland in particular, and let's keep that going for the next week or so. Our officers will be out and about making sure people do the right thing. At our road borders, again, we saw very good compliance, people coming through, so 2,239 vehicles intercepted and only one turned around. At our domestic borders, air borders, that is, 1,745 passengers processed, 5 refused entry and 108 into quarantine, and a late rush before the change of the cap with 330 international arrivals yesterday, so 265 in the cap. So we will see that start to reduce as that cap kicks in. Thank you.
Dr. Young, can you just explain why you think these latest cases are unrelated to the recent outbreaks?
Well, the 12-year-old boy returned from the US on the 21st of June and then went into hotel quarantine in Sydney and arrived back here on the 9th of July and became sick that evening. So he's acquired it in Sydney, either in hotel quarantine, we're just working that through where he's acquired it in Sydney, but he's definitely unrelated to any of our cases here in Queensland. The airport worker lives in Tarragindi, so we really need to wait for whole genome sequencing results. So yes, she could have the alpha variant that's been circulating in Brisbane, but she's not a known contact. She could have the Delta variant because she works at the international airport. She's part of that Menzies group of workers, so she could have contracted there. There are just too many unknowns here to work out where, but I suspect she's got it there at the airport as a new outbreak. But we'll find out later today. But that's what concerns me, that I suspect we've got definitely one totally new outbreak and potentially a second.
Is it possible the 12-year-old boy could have had a long incubation period in hotel quarantine, or do you believe it is a leak in the hotel quarantine system?
It's unlikely to be a long incubation period, but that's not impossible. I need to now get all the information from New South Wales for all his test results for day 0, 5, 12, and if he had a day 16 test. So I need to get all of those, and that'll give more information. But the most important will be the whole genome sequence. That'll help it sort out where he's got it from.
As far as you're aware, he only visited the Aspley Medical Centre?
And the pharmacy next door and the Kipperine testing centre. At the moment, yes, that's all I believe. And he came through the Brisbane International Airport, through the Brisbane Domestic Airport, of course, but transited very quickly. He didn't go to the bathroom or stop at any shops.
And because they've done the quarantine down there, they weren't required to quarantine here?
No, if people have completed quarantine in another state and immediately transit from that quarantine facility to the airport and back to Queensland without using any public transport, then there is no need for them to quarantine in Queensland. That's correct.
What job was the airport worker doing? Who were they doing?
I don't have those details yet. I only got that information through the night. So.
How does it be that she was fully vaccinated and yet is still...
Well, we know that happens. We've seen that. So the issue will be she's very unlikely to become particularly unwell. She's very unlikely to need ICU and extremely unlikely to die from the infection, but she can still pass it on, which is why we all need to be vaccinated for our own sakes, not necessarily for people around us.
Is she really sick at all? Does she have any symptoms?
She does have quite a few symptoms, but no, she's not critically sick.
There were some new contact tracing sites in the Ipswich area yesterday. Are they linked to a current cluster in Queensland?
No, they're not. So we had a Queenslander travel to South Korea, and South Korea tests everyone on arrival, and they notified Australia that one of the people they tested was positive and they'd come from Queensland. So we're just as a cautionary step notifying where that person was in case they acquired it here.
But you don't think they acquired it in Queensland?
I don't know, but we're just taking a very precautionary step. So we're not sure about what that testing was in South Korea, but we know a lot of countries test people immediately on arrival, as we do ourselves in Australia, and get positive results. And sometimes they're false positives, sometimes they're latent disease or persistent shedding. We don't know any of that because the gentleman's not here now, he's over in Korea. So that's why we've just declared those sites that he was at prior to going there as potentially venues of concern and asking people to come forward and get tested.
Are there any extra measures you're carrying out at the airport now, given the risk from that airport work?
Oh yes, there'll be a lot. So we'll be going in there as we did with the first 2 workers who were positive and testing a large number of people and working through all of their contacts. So as I said, I don't know exactly where they work at the airport. We'll have to just go through all of that and work out where she's been. But she did do 3 shifts while infectious because we always go back that 48 hours before the symptoms start.
Dr. Young, you said the boy started to develop symptoms on July 9 when they arrived in Brisbane and didn't get tested until July 13. Are you disappointed to the family 4 days to get their child tested?
They're the things we'll discuss with the family today and just find out what symptoms they had. We all know people can have such mild symptoms that it's only when you talk to them that they go back and say, oh yes, I did start getting something. So we'll work all that through. But he was at home with his mother and didn't go out and about, didn't go to school. So we'll just work that through.
Does there need to be any further measures put in place at the airport, just considering there have been several workers now that have picked up infections there?
Yes, so we want all our workers there to be fully vaccinated, which this individual was. So we're pushing that and we're working with the airport to get that done. That's critically important. And no matter where we are in the pandemic, no matter what's going on, we require people to wear masks. And it's a really good point you've raised because I've been to the airport a few times in the last few months, and not everyone is wearing masks. So every so often we do reiterate, and we need to do it again with the airport, that they have to have people wearing masks. That's critical. So anything you could do to help assist with that, I'd be very grateful.
Who is keeping track of how many airport workers are vaccinated?
We're working that through with the managers at the airport. So we want all airport workers to be vaccinated. They've had that opportunity for quite a while now. So we're just working through to make sure. And also we want all flight crews, both domestic and international, to be vaccinated.
So is it your understanding that, for example, the Brisbane Airport Corporation would be tracking how many people work on their property are fully vaccinated?
Yep. So they've been excellent, and they've been working with us to assist it to happen with everyone who works on that site, remembering they don't employ everyone.
But are they, I guess, keeping records of who is it? Is it because obviously employers could maybe go to their GP or go to an outside clinic? Is someone actually keeping track of which individuals are and aren't?
Each of the individual people who are the employers, yes, I'm sure they're doing that. But I don't have a consolidated list.
What about subcontractors as well? Would it be your expectation here?
Of course, absolutely.
What needs to happen with these outbreaks for you to decide we need another lockdown?
This is too early. I got this information during the night. I've been trying to get as much information as possible, so I had to brief the Premier. I just have to get more information before I go and hypothesise what might or mightn't happen.
Dr. Young, there's quite a few AFL teams coming into the state today.
There are.
Are you worried about...
Well, no, because they've got really good plans. The NRL and the AFL have been absolutely fantastic because they've been doing this for so long. So they know exactly what they're doing and they make sure that it happens.
Is there going to be a more official sort of AFL bubble arrangement like the NRL, or is this sort of once-off teams flying in to do a game?
They work with their players, so they are in a bubble. So that's why I'm less concerned, because they've all been in bubbles while this has been happening around them. So in terms of risks, they're a lot less risk than the average person in those communities, and they'll continue working that through.
Dr. Young, we heard about some 8 track and field athletes in Sydney who wanted to get to Cairns to join their training camp. Why weren't they given exemptions to do that?
Well, of course they were, but they chose, and I think very sensibly, that they would have to come into quarantine like the NRL players. They'd have to go into a venue, into quarantine. We'd give them training facilities, but to be honest, they're not as good as the training facilities they'd have access to in Sydney. So they made choices about what they want to do. They could not have joined their colleagues because they have to be in quarantine. So those track and field athletes who are in Cairns, who are from Queensland, are already there. They're not in quarantine because they don't need to be, but they wouldn't be able to interact with these from Sydney because they're coming from a hotspot. So I'm positive that the Olympic people all made the best decisions they possibly could for their athletes. But yes, we will support people coming into Queensland, but they must quarantine. So that's how it works.
Has there been any development yet in terms of making it mandatory for all workers at those hospitals with COVID wards to get a COVID jab? Has there been any development?
Well, it is already mandatory that people in the COVID wards are vaccinated. What I'm doing at the moment is consulting with the staff, with their management, with unions, about making anyone who works on that entire facility vaccinated. Well, we need to do that consultation.
How long will that take?
I need to do the consultation. It won't be long, but we just need to work through that process.
Yeah, when are you going to Tokyo?
On Sunday.
When are you coming back?
Sorry?
When are you coming back?
I think it's a week, but can I just make it very clear that if we were in a situation like New South Wales, I would not be going. But I am going at this stage, and let me also make it clear that I'm essentially flying in, doing the requirements of quarantine in Tokyo. I am presenting in Tokyo with the Lord Mayor and also the Federal Minister. I think then we have meetings in that same hotel. I am not attending any events whatsoever. I then fly back into Brisbane and I do 14 days hotel quarantine. And within a week we will know whether Queensland is going to secure the 2032 Olympics. And that's exciting for everyone in this state.
Are you nervous about going into hotel quarantine given there's been so many breaches?
No.
Premier, we've heard about a foster care conference that was cancelled on the Sunshine Coast. They got kicked out of there because of the NRL.
Look, I would expect, I don't know about those specifics, but can I say I would expect the NRL to be working proactively with any group or organisation or family that has been impacted. That would be my expectation. And I think Queensland's expectation.
Suggest they do that exactly?
Well, the NRL have people, they have corporate relations people, they have got a whole team that can work on those issues.
It's a bad look, though, that our foster carers, the people who do so much for our community, are being kicked out for a footy team.
Well, I think that they'll be found alternative arrangements. That would be my expectation.
Who makes the call on which hotels they move into?
The NRL is my understanding, yeah.
So they get to choose?
Yes. Yeah, and they have to have like some training facilities there. Okay.
Could I quickly just ask Health Minister?
Yep, last question.
Earlier in the week about expecting shipment of vaccines today. Has that shipment arrived and how are the stocks at the moment going forward?
Yes, so we received our supply, which I think was 64,500 on Tuesday, and with 62,000 due today. So all indications are that second supply will arrive today, which means we can honour all of the bookings we already have in our system at our state vaccination clinics, as well as allowing people who are due their second dose to book in through the 134 COVID number. So if you can't find a booking on the public links, ring 134 COVID if you're due for your second dose, because we have bookings reserved for those second doses, and of course for our frontline workers. We are taking bookings beyond the existing bookings, so from October on the basis that we are expecting more vaccines to come from the Commonwealth at that time. But we are on track and we're very happy with the vaccine numbers that we are seeing and the number of people already being vaccinated. But of course, we're only doing a certain group. So the rest of the population, particularly 60 plus, are going to GPs if they're not frontline health workers. So we ask you to contact a GP. If you're in the regions where we've got the pharmacies doing it, contact a pharmacy, get your first vaccination, or if you're due for your second, please.
Do you have that correspondence yet from those hospitals regarding?
Yes, I have. So I can say that there is in-principle support across all of our hospitals that are managing COVID wards to mandate the vaccination. Now what we need to do is work with the hospitals as well as the external stakeholders about how we implement that in an operational way, because there'll be staff who won't be able to get it for various reasons or are unwilling to get it that we need to work with. We don't want to discriminate or disadvantage people, but we do need to make sure that everyone who is in these hospitals can get vaccinated and are vaccinated. Remembering, National Cabinet has mandated aged care workers to be vaccinated. They gave a 3-month transition time frame for that to happen. So you can't make this happen overnight, but I've looked at the figures and can I say I'm so happy with the high level of vaccination already, broken down across medical professions versus admin and other staff across these hospitals, and we are seeing very, very high levels of medical staff who are already vaccinated voluntarily in these hospitals.
Thank you, everyone. Thank you.